Hi, what happens to depression if no intervention is given? Let's find out today. I'm delighted to welcome you to another episode of Mindscape Matters, a channel to discuss mental health and more. I'm Dr. Mohan Raj. I'm a consultant psychiatrist based in Chennai, and I'll be with you as we discuss various facets of mental health. For many people, depression will occur as an episode and will eventually subside. The duration of the episode will vary from person to person. In most research studies, it was found that the average duration for spontaneous remission of depression is about 6 months. Let us take this as normal range of mood. Normal range is not one line, two lines, because we will have normal happiness and also normal sadness on any given day. The upper line denotes happiness and lower line denotes sadness. During depression, the person would have much more sadness than normal and for much longer period. For some persons, the duration could be 1 month or less, but for some people, it could be 2 years. If the depression is secondary to an external stress, like say, loss of a person, loss of a job, financial stressors, interpersonal problem at home or at office, or any external stress, then the depression will subside if the external stress is dealt with adequately. In such cases, the duration of depression is likely to be shorter. Now, if the external stress is only a trigger and they also have some biological vulnerability, the depression duration is likely to be a little longer. Now, if depression happens without any external stressor, then the duration is likely to be much longer. Some persons would have a much longer duration of depression without spontaneous remission. We call it as chronic depression. I'm not quoting percentage of people because each study has a different number. That's why I'm not quoting. Now, in chronic depression, in addition to the depressive symptoms, they will have change in their personality. They will look at everything negatively and would respond accordingly. Some of you might ask, why do you intervene in depression if it can spontaneously go away? Why poke your nose into it? The reason for intervention, the first reason is, why suffer? As we saw a little earlier, some people can have much longer course, much longer duration of depression. The emotional pain is immense. And why should anybody go through it when there are effective remedies available? The second reason for intervention is to prevent the consequences of depression. One of the significant consequences of depression is suicide. Now, early intervention can prevent this possibility. We'll discuss about suicide in detail in future episodes. There is one more consequence which is very subtle and is not visible to others. It is loss of self-esteem, low self-confidence, and loss of interest, which will make a person miss opportunities in work and life. We have discussed this in detail in an earlier episode, and if you have not seen it, I've given the link in the description. Now, what happens after the first episode? Some people have one episode and will not have depression again. Some others will have one episode, then there will be few months without anything, few months they'll be normal, sometimes even few years, and then they develop the second episode of depression. Some others have multiple episodes of depression with intervening period of normalcy. We call this as recurrent depressive disorder. We saw that some people can have chronic depression, that is depression for a much longer duration. And in some of them, the depression will be severe. In some of them, the depression will be mild, low-grade depression. In such people, in addition to the low-grade depression, they can have episodes of severe depression superimposed on them. Their course will be like mild low-grade depression followed by severe depression, then mild low-grade depression without coming back to normal mood. Some persons, after their first depressive episode, either immediately after the episode or after few days of normalcy, develop a different set of symptoms, completely opposite to depression. The person would be extremely happy and much more happy than normal happiness. We call this episode as mania and the illness together as bipolar mood disorder or bipolar affective disorder. Let us discuss about mania and bipolar in detail in the next episode. Thank you for watching this far. If you like this video, please tell 4 of your friends. Tell them there is a Tamil version also. Stay tuned because Mindscape matters. Bye.